Hello, and welcome to this episode of CQC Connect, the podcast from the Care Quality Commission. CQC has an ambition to be a world-class regulator, driving improvements in how people experience health and care services and working towards a safer future. To help us achieve this vision, we are developing a new strategy to start from 2021 that builds on the work we've done previously and takes us forward. My name is Sam Wallace, Provider Engagement Lead here at CQC, and today I'm joined by a guest to discuss one of the themes of our new strategy, smarter regulation. To start off, I'm going to ask my guests to introduce themselves. Natalie, would you like to say who you are and what you do at CQC?
Yes, absolutely. Hi, Sam. So my name's Natalie Coleman. I'm a policy manager here at CQC. I primarily work on our acute policy team, particularly specialising around our regulation of the NHS, but I'm also currently working as the strategy lead for our smarter regulation.
Great, thanks, Natalie. So I guess to start off, it'd be interesting to hear a bit more about this theme. What does it cover? What are we looking at under smarter regulation?
Yeah, so I think if I had to give sort of the elevator pitch for smarter regulation, it's really about thinking about how we prepare for the future. We know that we need to be smarter in how we regulate. We want to be more effective and efficient, and we want to use intelligence to be able to tailor our work to individual services, and to also be able to target our resources where we know that they have the greatest impact. I guess the aim of all that is really to be able to provide up-to-date, high-quality information for the public, for providers, and for all our stakeholders. So that would be kind of the theme, I guess, in a nutshell, but a huge amount of kind of work that sits underneath that.
Great, thanks. I mean, that sounds like it covers quite a few different areas of our work then.
Yes, absolutely, and it's really about thinking through, what's the evolution of CQC? What does it mean to be smarter in the way we work, to be future-proof, to be ready for innovation, and to be able to facilitate and support that in the sectors in which we regulate, right the way through the point of registration, through to kind of our ongoing monitoring inspection of services, but also thinking about our independent voice and what we can, what's our unique insight that we can share with the public and with providers.
Great. And why is this such an important area for us to be thinking about in our new strategy?
So I think there's a whole host of things at play here, really, Sam. So we know that in 2021, for the first time, we've got a baseline understanding of the quality across all of health and social care. But we also know that the world out there is changing. And I think there's a couple of different angles on that. So, the health and social care system is continuing to evolve and will continue to do so. And over the next 10 years, the services that we regulate will no doubt change significantly. Some of those changes we can anticipate. So thinking about, moves towards integrated systems that encompass primary and secondary care and link more closely to social care, or increasing care in the community, or digitally enabled primary and outpatient care. But we also know there's going to be lots of developments that we can't anticipate. I think the other piece is that we know that health and social care resources are limited, but that demand for care is growing and that providers are under unprecedented pressure, particularly at the moment, and that they're finding new ways of working efficiently, and we need to adapt to that. Again, from an internal CQC perspective, like I said, we've got this baseline understanding of quality now. And alongside that, there's this ever growing amount of information and data that's available to us. Technology is available to help us, and we really need to build on that progress that we've made around being intelligence driven. I think there's some really interesting things for us to think about as well around kind of the regulatory model. So, to get to a space where we've got this understanding of quality, it's required us to undertake really detailed inspections against these, really significant inspection frameworks, to be able to gather evidence and generate ratings. But that's quite a rigid way of working. and it doesn't always allow us to target our resources where they have the most impact, or to always be able to focus on risk and recognise where quality is improved. So we really need to kind of evolve, and it's sort of, what is the next step of the model? What does it mean to be more targeted, to be more tailored, and to be smarter in the way we work? We want to be relevant, we want to be responsive. And again, during 2020 and the COVID-19 pandemic, it's kind of a really interesting time to be thinking and having these conversations where, we've stopped inspecting for a period of time, and we know that when we return to inspection, all of those topics around being targeted, focusing on what matters most to people, are going to be really important for that return as well as for the next strategy.
Great, thanks, Natalie. That sounds like it's going to be a theme that's quite central to how we develop as a regulator. Are there a couple of key areas where you think we're going to be doing some quite interesting work to support this theme?
Yeah, I think so. So I think the kind of overarching question that we're thinking about is what might a more targeted and tailored approach to regulation look like, and how might that result in us being able to provide up-to-date ratings and information for providers, for the public. So, and I think there's kind of a couple of different elements of that it would be interesting to talk about. So I think the first one is that we know that inspections don't always capture everything, and that things happen in between them. And so really where we want to shift to is this idea of how do we use our full regulatory toolkit to assess quality, stepping away from that idea that inspection is everything. Connected to that, we've currently got these very rigid inspection frequencies, and we really want to kind of shift the conversation and the focus to making the right intervention at the right time, thinking about how that's going to be tailored for different types of services, different types of risks, thinking about how we might utilise that in the improvement space. Again, thinking about the regulatory toolkit theme, we really want to harness different ways of gathering views on quality. In particular, we want to make sure that we can use the eyes and the ears of people using services and people working in services as well. And using that alongside things like targeted inspections, alongside stakeholder information, national and local data sets, relationship management, provider self-assurance, accreditation, and there'll be lots more other tools that we can build into the kit. But the idea of how do we have all these different views and lenses on quality that are continually informing us. And kind of feeding into that then, I guess, is this idea that we really want to be able to update ratings much more frequently, so that they really truly are providing an up-to-date view on quality. And this needs to be not just relying on kind of these comprehensive, big kind of set piece inspections to update ratings, but using everything we know about quality in a service. So again, being able to respond much quickly, in particular to when providers are generating improvements in their services, so we can really make sure we're reflecting that in a timely way. Again, building on that, in our current strategy, shaping our futures, a huge part of that was around kind of that promotion of a clear definition of quality, and we really want to continue on that work as well. So making sure that we have that clear shared view of quality that's accessible and understood by providers, stakeholders, and members of the public. And so from the point of registration, we really want to be building open relationships with providers to enable effective and proportionate regulation, as well as just making it simpler and easier for providers to work with us, and particularly around how they share kind of information with us, particularly around a view on quality, so that the providers can really easily demonstrate the quality of care they're providing with us. And again, that feeds into that always on view that we're really keen to work towards.
Great, thanks, Natalie. I guess like hearing you describe those pieces of work, it sounds like this strategy theme touches on loads of the different areas that providers and other stakeholders interact with us. Thinking to the future, say in 3 or 5 years' time, what do you think success would look like if we are a more smarter regulator? Where would we like to be in terms of an outcome for this theme?
Yeah, so I mean, I think something that's really important about this smarter regulation journey is that it's going to take time, and I think we need to be really kind of clear on that. And I think the other element of that is that its development is going to look really different across the range of services and sectors that we regulate. Um, but in terms of success, I mean, I think a key one for me is that success would mean that whatever we develop now is flexible enough to respond to changes in innovation in health and social care, so that we're in a place where actually the regulatory model that we've developed isn't a barrier to innovation or change, but it can just adapt and evolve with the sectors. Um, I think the other key things is that we can really focus on the things that matter most to people. I think thinking about the current COVID-19 pandemic is that actually we've seen a real shift in those things that matter most to people. We're seeing that the importance of issues around health inequalities, around access to services, around infection control and prevention and PPE. And at the moment, those are rightly so the things that people are most interested in. But actually, we want to be able to adapt to whatever those key issues are in 5, 6 years or 10 years' time, and that the model that we build can evolve and support us to be able to have a much more dynamic lens on what quality looks like.
That's really interesting, and I think that thing about a model that's future proof almost, that can be then used in whatever health and social care system arises in the future is really useful to think about. Um, so we're still in a fairly early stage of developing this strategy and this theme, and we're keen to hear from providers, people who work in health and social care, and others to help us develop it further. If people are going to feedback, what do you think the key questions are that we need an answer to, or the key things they could tell us that will help us develop this further?
So, I mean, I think at its most basic, I would just love to hear what would smarter regulation mean to you. To anybody listening to this, the concept of CQC as a smarter regulator. What might that mean? What might that feel like? Um, in terms of some of the detail underneath it, one of the things I mentioned that we're really interested in exploring is this idea of a regulatory toolkit around having, it's about making the right intervention at the right time, and we have a range of tools and techniques and methods that we might use to think about quality. And what tools would people like to see us using in that toolkit? What might give some really valuable and interesting insights into quality in different types of services or settings? I think the other thing is kind of just a bit of sort of reflecting on where we are now. What parts of our current ways of working do feel like they add real value versus those that actually don't feel like they're the most insightful, or they feel burdensome. So would really love to hear kind of reflections as well around kind of people's experiences of working with us in our current ways of working, and around those things that work, and those that we should be maybe thinking about doing less of. We're really keen to think about what might an effective and proportionate regulatory experience feel like, and particularly from a provider point of view, we really want to hear those voices coming into this conversation.
Thanks, Natalie, and thanks for joining us today to talk about smarter regulation. And thanks everyone for listening to this podcast. If you'd like to find out more about our strategy and to feedback on some of the questions Natalie's highlighted on the smarter regulation theme in general, you can do on our digital engagement platform Citizen Lab, and the link to that is in this episode description. Look out for more podcasts on our future strategy and on other topics from the Care Quality Commission, and we look forward to speaking to you again soon.